Good afternoon, everyone. Thanks for joining us on our media briefing for a Monday. We're glad to have you with us. We're going to start our briefing today with some good news from our county library director, who's going to tell us a little bit about how to do a summer reading program virtually. A lot of creativity went into this, and Hillary Thayer is joining us now.
Thank you so much for inviting me. I'm going to go ahead and share my screen. Can everybody hear me okay?
We can hear you.
Okay. A couple of things going on this summer. I first want to say thank you so much to my amazing library team who had to really retool how we were going to do summer reading program with not knowing how we were going to be able to do our usual interaction with the kids. They retooled from scratch, and we now have multiple ways to sign up for summer reading. It starts today. You can give us a call Monday through Saturday, 10 to 6 in English and Spanish, 883-7555. We will sign you up over the phone. You can email us at that email address on the slide or send us a text. All we need is name, address, age, grade level, and we are going to mail to every participant their free book. We're starting summer with putting books in people's hands, and a reading log or a bingo card. We will mail that to your house so you can get started reading. You can also download the items from our website at emcfl.org. We're also headed for online participation, a brand new service here in Monterey County. You will be able to log in and log your participation entirely online. The program is called Beanstack, and it was sponsored by the California State Library and the California Library Association. This is a service they brought to public libraries all over the state, knowing that all of us needed to really help kids in our communities overcome not only the summer slide, but now we have the additional great COVID learning slide that I don't know how many of you heard the governor's press conference on Friday that he talked about how serious and drastic the learning loss has been this year. And reading is such a crucial part of overcoming learning loss. Another aspect that we have is lunch at the library. I'm going to put up my contact information briefly while I talk about lunch at the library. At every one of our 16 branches, one day a week, we are going to be passing out free meals to kids. These will be sack lunches in the grab and go format. We won't be able to sit and eat together like we were able to last summer, but anyone under 18 can come get a free lunch, and parents can pick up lunches for their kids. That schedule is on our website at emcfl.org once a week at all 16 locations, and it starts tomorrow. So this week is an exciting time for the libraries. We're bringing back 3 services, newly re-envisioned for how we're going to do them this summer, and we're looking forward to bringing back more. I expect by next week, I'll be sending more press releases with more library services coming back. And I am available to you to answer any questions.
Thank you very much, Hillary. That is really great news. Then now we'll move on to the topic of the day, public health. We have Dr. Moreno with us today, and he's going to give us an update about what has been happening following the governor's announcement on Friday and looking forward to this week. Hi, Dr. Moreno.
Hey, good afternoon, Maya. Hello to everybody. Yeah, so last week the governor released guidance for additional sectors and businesses within those sectors that they will need to follow to reopen. And so there'll be the guidance there is to help employers reopen with modifications that reduce the risk of transmission of COVID-19 between workers and also between workers and customers. So one of the requirements for counties like Monterey that the governor made was that the local health officer look at the indicators that each county had chosen to monitor the pandemic in their jurisdiction prior to agreeing or allowing those different sectors to open. And that the governor had recommended that those sectors not open until June 12th. And one of the reasons why the June 12th requirement was in there, or recommendation was in there, is because there's quite a bit of guidance documents that were released, and each of those guidance documents have, I think, pretty significant modifications that each business has to implement in order to protect workers and protect customers. So that's one of the reasons I believe that the June 12th date was recommended, so the businesses have time to put together, if they haven't already, put together their COVID-19 prevention plan and bring employees back or virtually train employees on the various aspects of the plan. And there's other components, and we can all go on the website and look at each sector that we're interested in. But there's recommended guidelines for what topics to train employees on, similar to guidance that had been put out prior to June 5th with the other sectors. There's guidance on social distancing. There's guidance on monitoring employees and how to check employees either at home for symptoms or when they arrive for symptoms of COVID or fever. And then there are the documents also has business and activity specific guidance towards the end of each document that will be most commonly encountered as each business looks to modify their protocols or procedures and the services that they provide. The other reason that the June 12th date was recommended is that there had been just recently some other sectors that opened up, and there was also some recently 2 major weekend holidays where large, there were, well, not large, there were larger than usual family gatherings over Memorial Day holiday and Mother's Day, and the extra week from the announcement to the implementation of reopening gives counties a little bit more time to see how things are going locally. So I did review the indicators, and we did have, I did focus on 2 indicators in particular, and that is, which are now posted on our website. And those the indicators I'm really focusing on are the ability to protect people at high risk of COVID-19, and also our ability to maintain our surge capacity at our hospitals. So in those 2 indicators in those categories, we're still doing okay. We haven't had a significant increase, rate increase in hospital bed occupancy. And we also have, we're still able to, most of our facilities, our skilled nursing facilities, excuse me, have at least 14 days of no new cases, and we have 1 death in the last 14 days, I believe. That's our current status. So that's really been the priority since when this pandemic started here in Monterey County, protecting those at high risk and also having adequate surge capacity. And it continues to be a priority. There are a couple of categories where we've met the threshold. One of them is the 14-day cumulative incidence per 100,000 population. So when we met attestation, we were at 28 per 100,000, 28 cases per 100,000 population, and now we're up to 53. And the other is the test positivity rate. When we submit our attestation, we were at just around 2.5%. We're up to 12%, which is what we're seeing also in some other counties in California. That recent activities, release of a reopening of activities or businesses with modifications does increase the. We're still in a pandemic, so even though modifications are being put in place, it does still add additional opportunities for possible transmission of COVID-19. But that's going to happen in a pandemic, and what we're doing is looking at our indicators and seeing if we're in a place where we can introduce and reopen more activities, more businesses with modifications intended to continue to slow the spread of COVID-19. So businesses can all the businesses that are included in all of the most recently released guidance documents can expect to open if they wish to do so, and they need to go to the governor's website and read and understand and develop their protocols and their plans to implement the guidance. And if they have questions about the guidance, or if they have questions about whether or not they fit in any of those guidance documents, they're welcome to call our advice line and speak to one of our public health employees and ask their questions. I also suggest that the general public, if you're not one of the business people working in the business, and you're thinking of visiting one of these businesses when they open with their modifications, to also go to the website to get an understanding of what you should expect when you visit one of these businesses that will be newly reopened. So look at the sections that talk about signage and hand washing opportunities in the establishment, social distancing, for example, and look at the particular guidance to have an understanding and expectation of what you should be seeing if you decide to go to some of these businesses. And if you're a worker and called back to work, or your work hours are going to be increased, also look at the guidance so you can see what each workplace should be doing, what modifications should be in place when you return to work, so that your risk of being exposed or exposing somebody else in the work site or exposing customers is reduced as well. So I think we all, if we're going to be involved with any of these reopenings, we should all take a look at the guidance. So that's I think the highlights of what's happening right now. And Maya, I'll go ahead and hand it back to you.
Thank you very much, Dr. Moreno. I know we'll have some questions for you. They've already started to come in, and we'll go ahead and get started with those questions. The first question is about protests. Are any and all protests safe or even legally allowed in Monterey County without full compliance with face coverings and social distancing rules? Does the issue involved in the protest make any difference? And should we expect to see an increase in coronavirus cases in the wake of recent and ongoing protests?
So thank you, Maya. So so previous guidance from the governor's office did provide guidance on protesting, and and there are guidance on I believe on the crowd size, and there's also no distinction as to what topics are allowed or not allowed for people to protest. And the other part of the question was, can we expect increased cases? I think yes. I think that we probably will, and it's not just because of protests. Again, anytime we leave our homes, even if we're covering our face and following social distancing, there is still increased risk. I mean, it's low with all the modifications we're taking, but there is more risk outside your home than inside your home. There is additional risk going outside your home of getting exposed. So we'll have to see if we have that. We of course will be asking anyone who tests positive where they've been during their infectious period to determine whether they had a known exposure to a known person with COVID-19, or if they've been in large events or gatherings prior to the onset of symptoms, or prior to having a positive test. I think it's the governor. I believe made a point that we have a right to have our voices heard, a right to free speech, we really depend in large part on Monterey County residents to if this is the way they choose to have their voices heard, to follow the social distancing and to cover their faces, and to invite others at protests and demonstrations to also cover their face and practice social distancing. So I think I got most of the questions answered, I think, Maya.
I think you did. Thank you very much. And I see our CAO, Charles McKee, is on as well. Is there anything you'd like to add about the protesting aspect of this?
No, I think Dr. Moreno covered it. Thanks.
Okay. Great, thank you. Next question, Dr. Moreno, do the county's contact tracers believe that the growing number of cases in Salinas and South County is due, at least in part, to migrant workers traveling to Monterey County for the summer harvest season? And if not, then why do contact tracers believe cases are rising in Monterey County?
Okay, yeah, very good point. So several weeks ago, we had meetings with our Ag Commissioner, and I think our Ag Commissioner or representative was on one of the briefings, and I believe, I may be wrong, but the information that was shared from the Ag Commissioner kind of foretold that we were probably going to see might see some increased cases among the ag workers. If I remember the numbers correctly, I think in peak season, there's about 50,000 ag workers, according to a verbal report that the Ag Commissioner provided. And about half those individuals live in year-round in the Monterey County in this area. And the other 25,000, I think it's about 8,000 or so are H-2A workers, and the rest are migrant, meaning they live in the United States, but they have a home somewhere else, and they travel as the work is available. So we are seeing that just like prior years, and we are because of that. I think we will if farm workers and people engaged in the farm industry travel from another part of the state or another state to Monterey County to work, and they come from a place with a higher rate of COVID-19 than we have. There's probably a higher risk that they've been exposed, so it's really, and when they get here, they could develop symptoms or not, but they could develop symptoms when they get here. So it's really important. So that could be contributing to increases in the numbers of cases that we have here in Monterey. It also depends on who's getting tested. So if we have groups of individuals being tested on any particular day or over a few days, and it's a large group from a particular sector, we could also see increases in positive test results among a particular industry, and that we post on our website. So it's really important that, for that reason, it's important that ag, and not just ag, but all our industry sectors really take that the guidance seriously, have protocols in place to screen individuals, workers, either before they come to work or as they arrive to work. And if they have a fever, subjective fever, a measured fever, or have symptoms consistent with COVID-19, that those workers be not allowed to work, and that the employer and the employee can contact the county 211 or contact the county to see if there is any if there are any support services that they might be eligible for. And I believe we do have, I think, I'll have to check with Charles, but I think, Charles, we have an arrangement with CRLA, California Rural Legal Assistance, to provide some to support those individuals in finding available services that they might be eligible for. So there are some resources out there for workers who are sent home and are told not to come to work. Is that right, Charles?
Yeah, there are resources, different areas, but both at the state level and also from local organizations like CRLA. If there are others that I think that the state level to help with resources for people that might need guidance on sick leave and things like that that might be available to them. Not sure if we lost Maya there, if she's still trying to get back on here. It's like some technical difficulties. Yes.
It's
So
not.
Go ahead, Maya.
Can you hear me? Is this good? Okay, we got it back. Thank you. So Dr. Moreno, I have a question for you on additional cases. We saw an increase in cases by close to 100 over the weekend. Is there some concern from the health department now about reopening some business sectors?
So thanks, Maya. So the list of or the group of the business sectors that the governor released guidance on and permitted local jurisdictions with variants to reopen with modifications is still considered to have somewhat higher risk than the lower risk sectors that opened up previously. But so there's a need for people to be aware that when businesses reopen, their businesses aren't going to reopen, and we're not going back to the way things were before COVID-19 at this time. And it's partly because we are seeing increased cases, and this is a pandemic, and so we anticipate that as the pandemic moves forward, we expect that we will have periods of time where we see greater numbers of cases reported over a day or over a period of time. And those could be if our case investigators and contact tracers will do their best in interviewing people to find out if maybe there was a particular event that may have contributed to increased exposures, or if there's not necessarily an event, but a holiday or a reason for people to get together with families and friends that might contribute to that. So we are going to see increased numbers as we move forward, but there is also a real need to get people back to work, have people get back to meaningful work, and for eventually to have our kids and our youth become more engaged again for their health and well-being. So there's a balance that we're going to have to continue to try to find as we move forward. And again, it's really important that the businesses and people who are going out of their homes to visit these businesses and receive the services really adhere to the social distancing, hand washing, covering our face, and businesses need to develop and implement their prevention plans. We're really dependent on that, and our success is partly dependent on us being able to do that successfully. So I hope that someone answers the question, Maya.
Yes, thank you, Dr. Moreno. And then I had a similar question regarding numbers. The first question was about just generally 100 over the weekend, but there was another specific question about a spike in King City. And I wondered if the answer that you gave regarding the general increase in numbers would also apply to the King City spike.
So the King City, let's see, King City, I'll have to go back and, I apologize, I have to go back and see what particular might have caused, if our disease investigators were able to track down if there's anything in particular that would explain an increase in King City. When we get the reports of positive cases on any given day, that's where our case investigators start. They go from there and they make phone calls, and they have as Christy Miches explained, it's an iterative process where they'll make a phone call, they'll get some information, they'll call back to see how they're doing the next day, and then the individual might remember more information, may have talked to some of their family or friends and be reminded where else they might have been. And so this is an iterative process, so it takes a while, but I can check to see if our team has any information that would be helpful for the public in letting the public know what type of activities are increasing the general public's risk for exposure to COVID-19.
Right. Thank you, Dr. Moreno. And then here's another question. We're already hearing from readers with questions and concerns about businesses that have reopened, but where employees are not wearing masks or appear to be otherwise violating county orders and state guidelines. Does the health department have the capacity to investigate restaurants for alleged violations? And should members of the public notify health officials or law enforcement, or what should they do?
So I would, I'll start, and maybe Charles has some suggestions as well. But so the general public who wants to, this may take a little while, so everyone has a little patience, but when the general public wants to visit a business or engage in an activity out of their household, they, again, I recommend that they read the guidance at the state website to have a fairly good idea of what they can expect when they get to that business. If they arrive and they're not seeing any of the recommendations implemented, meaning employees that should be wearing face coverings are not, there's no physical reminders to keep social distancing and the like. Part of that, it is the responsibility of the business to implement those as a condition of being open. But I'll also suggest that Monterey County residents should also be willing and ready to make our own decisions. So if I'll just speak for myself now. So if I show up to a business because I feel I need to go there, and I don't see any indication of an attempt to maintain social distancing and employees aren't covering their faces, just to name a couple, there's no reasonable access to hand sanitizer, for example, then I would have to make a decision as to whether or not I want to go ahead and go into that business, or maybe wait for another time, or find another business that's practicing better social distancing and following the recommendations in the guidelines that the governor has put out there. As far as where they can report, I think that definitely there are a variety of options. You can definitely call our number at the health department, which is 755-4521. Some of these, in addition, some of these businesses are regulated and they're required to post their permits and their licenses where the public can see them. And you can see that some of these, you might be able to see one of these postings and determine that they're regulated by the health department. For example, restaurants get their license from permission to operate from the health department's environmental health bureau. And so you can call the health department and ask to speak with environmental health. There's also certainly the option of calling the city in which the business is operating, and voice your concern to a city representative who can share that with the police, or you can call the police and let them know. So those are just certainly a few options, and I think that's reasonable because we can't be our environmental health inspectors can't be everywhere all the time, every day, monitoring, and so we do depend on the general public getting information back to us about businesses that they have significant concerns about. And maybe Charles has some additional suggestions.
Thank you, Doctor. I think those are excellent suggestions. You would think that the power of taking your business elsewhere would be a great motivator for businesses. In addition, I think that customers could contact the business through other means than just showing up and letting them know that that they tried to frequent the business and that the business was not adhering to the plan that each business has to put in place for safe operations. I think that would be a strong message also.
All right, thank you both. Is the health department planning to ramp up efforts to try to stop the spread of COVID-19 in Salinas and South County? And if so, how?
So we are working countywide with businesses, with the general public, with advocate groups that represent and work on behalf of different populations in Monterey County to get information out about the fact that we're still in a pandemic, the fact that without social distancing or covering our face and following guidelines that we will still be at risk of exposure to the virus. We do have higher numbers in certain parts of the county, and we certainly do want to, as much as possible, focus some of our efforts in those parts of the county. We've in the area of testing, we continue to maintain the free testing site in Salinas and one in South County. We think it's very important that if we're seeing higher rates, it could be because we have better access because of the testing sites, but it could be because we just have more exposures among populations that may be having more individuals living in the same household. We do see quite a few transmissions, quite a bit of transmission between household members. So if there's more people living in the home, and I think we've talked about this before on these briefings, if you have more people living in the home, then there's more people in close who probably spent some time with a person who was while they were infectious, and we might see more cases there too. So we still want to keep as much as possible our testing sites where they're needed, so that people who have symptoms or think they've been exposed can get tested. If they're positive, take greater measures in working with public health to implement recommendations for isolation and quarantine. So definitely we're look at these numbers and we try to do what we can within certain communities to help to implement measures to reduce the spread of COVID-19, but we still have a county-wide responsibility. And so we do this type of work in all parts of Monterey County.
I would also add in there that obviously there different industries are in different areas of the county and operated in different areas in many ways. And the agricultural industry is obviously heavily concentrated in southern Monterey County, as well as the Salinas Valley and Pajaro Valley and areas like that. And we've had some great cooperation with the agricultural industry and different representatives to have some of the strongest protocols in place, some of the most cutting edge protocols that have been adopted elsewhere, and know that has to continue. We've also, as a society, asked the certain industries such as agriculture to keep operating, for obvious reasons. Excuse me. And those that have been operating for a long time are going to experience some transmission within their industries. And in addition, it's such a large percentage of our population that works in the agricultural community that that there's likely to be transmission within that community when you combine it with the fact that it is a operation that is been ongoing. It hasn't stopped, hasn't slowed down. In fact, it's now is the time of year where it picks up significantly. In addition, we've also partnered with different entities to help push out not only the education and the messages, but also trying to acquire personal protective equipment to be shared for those workers who are unable to get it through their employer. Although many employers in the ag industry are being forward thinking and making sure that their employees do have the protection.
Thank you, Charles. Dr. Moreno, is there an explanation for why the number of hospitalizations has decreased relatively little, even while the number of cases has risen?
Sure. So We are seeing, I'm not sure, thank you for the question. I'm grateful that we as a community have taken measures to slow the spread of the virus. And I believe, as a consequence of our efforts thus far, we've been able to maintain relatively stable hospital census for COVID-19 patients. And which means that we've been able to continue to have, at this time, adequate surge capacity in our hospitals. As far as why that's stable while the number of cases are going up, we're seeing some patients that are testing positive who don't have symptoms. And I think that and some of these people don't remember being sick prior to being tested. So that suggests that there are some people who have infection or were infected and didn't have any symptoms during their infection. We're still isolating them because we don't know if they're still infectious or they're getting over their infection, but they're still required to isolate. But what that I think demonstrates is that this virus has a wide range of impact on us. So we've got people who are infected and don't have any symptoms and only found out that they were positive because they got tested. And we have people who are needing long-term intensive medical care and people who are dying. So it's a wide range of impacts on the human species caused by this virus. So I'm also, I'd have to say, grateful that we do have people who are getting infected who aren't becoming gravely ill. And so I'm actually grateful for that because we are going to see cases go up, and I'd rather be in that scenario than having hospitals overrun with people in need of critical care. And so at this point, I'm hopeful that we can continue to practice our social and physical distancing and the other preventive measures in order to have a no or minimal rise in our bed census as we move forward into this pandemic and as we move forward with opening up businesses with modifications.
All right, thank you for that. And then here's another question related to the protests. According to this reporter, Elsa Jimenez last week endorsed public protests and demonstrations, even as you warned against attending events. Do you agree that people in Monterey County should publicly protest and demonstrate or not?
Can I jump in there real quickly before
Yes, please do.
Yeah, I'm not sure I heard Elsa specifically, but I'm not aware that she specifically endorsed it in this situation. I think my understanding was that she was recognizing the right to protest under the Constitution. And I think Dr. Moreno can elaborate and has already hit on the safety measures that people should take, whether they're out gathering for any purpose, but also recognizing that we have constitutional protections for things like protests.
Yeah, I think, Charles, I agree with, thank you, I agree with Charles. I think the people, we have a right to have our voices heard, and we can do it in a variety of different ways. And demonstrating in public is one of those ways. And just as we're trying to balance the economic benefits with the risk of exposure, leaving our homes and attending more businesses, we have to balance our rights to have our voices heard on a variety of topics, with trying to continue to minimize the spread of COVID-19. So I'm not saying that I'm for or against protest. I just recognize that it's a right, and we're going to have to balance that right to demonstrate with the need to minimize the risk of transmission to COVID-19.
Thank you, Dr. Moreno. And this is a follow-up, a request for you to repeat some numbers that you gave. Can you repeat the number of cases per 100,000 population and the positivity rate increase with prior numbers? And could you explain the increase? Dr. Moreno?
Sorry, so when we submitted our the attestation request for variance, we were at a doubling rate of around 2.3. And then for a while, we were between 5 and 6%. Interest rate recently gone up to 8. I think it's 12% as our last posting. So as we, I can't explain why it went from it's gone up to 12%, but I can acknowledge that as we move further into this pandemic, we are going to see more cases. We may continue to have a reasonable doubling time. It's been like, I think, between 20 and 30 for about a month now, which is a reasonable doubling time, which means the virus is spreading, but spreading slowly. But the numbers are still going to double over time, which means as we move further into through this pandemic, we're going to see probably a couple things. One is, as we have more cases, that means the prevalence of COVID-19 in Monterey County will start to rise. And as when we see that, then on a day-to-day basis, we would probably also expect to see the number of cases, the percentage of cases the percentage of tests that are positive, because there's just more, a greater proportion of people have it, and the number of cases as measured cumulatively over 14 days to also rise. So that's to be expected. What we really want to do, though, is to continue to slow the spread, which is indicated by the doubling time, and preserve our hospital surge capacity, and also protect our vulnerable populations. So hopefully that provided some answers to the question.
All right, thank you. And then can you explain the process for monitoring the indicators in the attestation, and what happens if Monterey County crosses the threshold of one or more indicators? Will there be a more stringent shelter-in-place order, or are we moving only in the direction of reopening?
So the process of monitoring the indicators is primarily right now it's a local process. So our indicators include the most recent data that we have available to us, and that's our team of epidemiologists are responsible for monitoring that, and then we review it on a daily basis to see if we're identifying trends and what might be, if there are trends, what might explain the trends, like the incidence rate and also the positivity rate. And then we make sure that we continue to work with our hospitals and skilled nursing facilities, because if any of them believe that they can't get the supplies they need, like personal protective equipment, then our hospital preparedness program staff will make special efforts to try to assist the hospital or the skilled nursing facility in acquiring what they need to get us back to a place where all or nearly all of our hospitals and skilled nursing facilities have the resources that they need. In terms of what would we do if, or would we have to be more restrictive if we exceed any of the indicators? Not necessarily. And the reason is because when we submitted our attestation to the state asked us to share what indicators we felt were important to follow in order to track the pandemic with the data that we had available to us. So these are indicators that are very similar to other indicators in other counties that submitted their attestation, and similar to other counties that haven't submitted an attestation but still following these similar indicators. There are some differences. We have like I think 7-day, I believe it's a 7-day rate of positivity. I think other counties might have had like fewer days or more days. So it really is, as we put these indicators together at the time, we felt that these were the ones that we had data for, good data for, and could continue to receive data and monitor over time. So we also have to keep that in mind, meaning as we move forward, this pandemic will follow some expected path, which I already mentioned, which is over time, the number of cases, even though doubling time may be good and we're doing a good job, the number of cases are going to go up and positivity rate is going to go up. And so those are things that can be expected. But this is, as I've mentioned many times, this virus is, we don't know, we still wish we knew more about this virus. This is our first go around with this virus. It's not like flu, where we can anticipate a little more what the flu might look like. We can't predict what a flu season will look like, but we can anticipate what to expect and plan for it. This is a brand new virus, and so there are things that are unexpected, are unseen, which will probably happen as it's demonstrated already. We'll find out new things about it. It may change, it can mutate, and we'll have to be flexible, and we'll have to make sure that we're doing the best we can with our epidemiologists to interpret the data as best possible. So long answer to a short question, but I hope that helps, me.
Yes, it does. Thank you. And then if we continue to see cases rise, would the health department consider closing business sectors in Monterey County that have already reopened?
So that's definitely an option. So we'd have to, a few things we'd have to consider. One is have to consider if what we're seeing is if the data we're seeing is reliable, and if we're fairly confident in our interpretation of what it means. We'd also have to determine if we're dealing with a unique situation here in Monterey County versus trends that are occurring statewide. And we'd also have to look at whether there's a particular, if there's a pattern where we might see particular types of events associated with outbreaks, or there might be particular type of businesses or particular businesses themselves where we're seeing repeat a pattern of outbreaks. I would prefer to hone in on the highest risk settings and environments and events, and as soon as possible try to remedy those by working with those responsible for those businesses or those events. And if they can't be remedied because the virus has changed and it's doing something different, then there's definitely a possibility that we would have to become more restrictive here in Monterey County, if not statewide.
All right, thank you. And now a question regarding contact tracing. How close is the county to meeting the state requirement for 65 contact tracing staff? And how long is that expected to take? And also, how about reaching the required 14-day supply of PPE for local skilled nursing facilities?
Yeah, I'll have to go back check, but I think Charles might remember. Charles was on the last call with Christy Michi, I believe. When Christy was Christy on the call, Charles, describing the case contact?
Christy's on this one, so maybe she can answer.
There she is. Oh, thank you. Yeah, so Christy, if you don't mind, there you are.
Hi, thank you. Good afternoon, everyone. So right now we have currently 45 contact tracers that are trained and available to take assignments and work with people. We are bringing on an additional 6 soon. So that's putting us up just slightly over the 50 mark. We are expanding as the need to expand occurs. So our goal is not to bring 65 people on and not have enough work for all of them to do. The goal is to monitor our needs and expand as we need to. So it may be beyond 65, it may be less than 65, but the important thing is that we have the ability, we have relationships established, training programs established, so that we can expand our programs as we need to.
All right, thank you. It's nice to have the source.
And Christy, what do you have an update for our planned participation in the statewide virtual training?
Yes, so there's 2 pieces to that, important pieces to contact tracing that we're participating in a statewide effort on. First is training, a standardized statewide training. And that is an opportunity that the state is providing to local health departments to train new contact tracers who don't have any experience in communicable disease or disease investigations on a standardized platform, so that the idea is that everybody gets the same training, everybody has the same skills. So as this epidemic shifts maybe slightly around the state of California, that we can deploy resources to where they're needed the most. So Monterey County is participating in that. We have had several people complete that training to date. I don't have the exact numbers, I'm sorry, off the top of my head. So that's one important piece. The second important piece is that the state is deploying a statewide platform to be able to document our contact investigation activities and make sure that we can adequately capture the information so that we can keep closer tabs on our folks that are being followed for contact tracing, and be able to organize that information and share it with other jurisdictions in instances where our contact investigations may cross county borders. And that's really important to help us become more effective in our contact tracing. So we'll be onboarding with that. I believe we're receiving training this week, and hopefully going to be rolling that out slowly over the next few weeks.
Thank you. And then we've had a lot of questions about protests, and I'm going to invite our CEO, Charles McKee, to come back on and talk a little bit more about that.
Sure, thanks, May. I see there's a couple messages in the chat from Kelly Nix, and his initial question insinuated that Elsa Jimenez had essentially by herself put out some endorsement of protesting at the same time that through the county health department, Dr. Moreno, were warning against gatherings because of this potential spread. And I think it should be noted that it wasn't just Elsa herself putting out an endorsement of protest. It was a letter signed by all department heads in the county, as well as the chair of the Board of Supervisors, to endorse the message that the protesters were sending about injustice in our minority communities. And I think that message still stands. And the right to protest still stands, and supporting that right to protest. But at the same time, we have to recognize that there are risks associated with any activities that we do. The activity of going out in the community today to visit a restaurant or a store, even if you're visiting an essential service, there's still a risk out there that there might be some transmission of the virus. And that's the point that I think Dr. Moreno was trying to make, and the point that I was trying to make, that there are rights that are established in the Constitution that we would support, we still support, but there's also a warning that should go out to say that whenever you're exercising any rights that you might have, as well as exercising the need to frequent a business for essential services, or now frequent a business for pleasure reasons, if those are allowed under the new guidelines, you should do so in a way that protects you and protects others.
Thank you, Charles. And here's a question regarding agriculture workers. Are ag companies required to inform all of their employees if someone at their facility tests positive for COVID-19? Employees have told us management at some facilities are informing them or telling them not to tell anyone that they tested positive.
Okay, so I think I'll start, Maya. So as with all cases that we contact and in order to begin an investigation, we speak with the person. In this case, the question is about a worker in the ag industry, who when we find out that they tested positive, we'll contact them, and we will determine with their cooperation when they were infectious and who they had close contact with when they were infectious. If an employee, in this case, someone who works in ag, and tells us that they work in a particular industry, and we determine that the employee can't, not because they don't want to necessarily, but they just aren't able to tell us everyone that they might have come in contact with at the job site, then we will contact the employer and let them know that there was an employee. And it's often necessary for us to tell the employer which of their employees was infectious, because that's maybe the only way the employer can give us the names of people who the employer believes were probably had close contact. And so from there, from our public health folks will reach out to those employees and let them know that they were close contact, while maintaining the confidentiality of the person who was the actual case. It's up to after that, the employer may want to disclose who to the other employees who that one employee case was, but that's not our intention. It's generally sufficient to let the employees know that they were exposed and what they need to do to protect themselves and the people that they live with, and to quarantine if that's appropriate. So that's really, I'd say the answer to that question is that it varies from employer to employer. There are some, I believe, there are some. Excuse me. There are some guidelines that the Ag Commissioner has put out that the ag industry is, I believe, many of them are doing their best to follow and implement and follow to decrease the spread. But I don't know that the employer in agriculture is required to tell employees that the name of the person, but they will work with us. And we hope to continue to get cooperation from employers, so they continue to work with us to at least inform the folks that we and the employer believe were close contacts. So at least they know they were exposed and they have the information they need to quarantine and monitor for symptoms and protect themselves and protect others.
Thank you, Dr. Moreno. And I'm going to try to sneak in one more question before our hour is up. For industries that are not addressed specifically with state guidelines, such as whale watching or recreational fishing trips, what guidelines should they use for reopening?
So thank you. Thank you for that. That was a good question. I'm glad you got that in there. So businesses may, it may be very obvious that certain businesses are included in the sector guidance, but there may be some businesses that aren't sure if they fall into one of the previous or newly released sector guidelines. And so what I encourage the business owners to do is to read through the guidances that they think they might fall under. And if they think they might, but they're not clearly called out in the guidance, I really encourage them to give us a call so we can understand what it is what their line of business is, what type of service they provide, and see if there is a guidance that actually would apply to them. So I think businesses, again, I encourage all businesses to go in there and look to see if they can reopen, and if they can, what modifications they have to make. We're at an hour, and at 1 o'clock, I'll finish by saying, reiterating that customers should go to the guidance as well, so they can have a reasonable expectation, an idea, and have a reasonable expectation of what they should be seeing when they arrive. And workers, this guidance is a lot of us who want to get out and benefit from getting some of the services. We think as a customer, and we want to protect ourselves, but we have to keep in mind that someone is providing those services, and that's the workers. And so those workers are going to go back to work, are going to have their hours increased, should also read the guidance and work with their supervisors, their managers, the business owners, to come up with creative ways to not just say, oh, we can't do this, it's impossible, but rather think creatively on how they might be able to do things quite differently and in order to meet the intended goal of these guidelines, which is to protect the workers and protect the customers.
Thank you, Dr. Moreno, and thanks for wrapping up our briefing now on that note. Thanks very much for joining us today. Our next briefing will be Wednesday, and we'll see you next time.
Okay.